So let's switch back over to health news because you haven't heard, you might know that the entertainment world now mourning the loss of actor James Van Der Beek following his battle with colorectal cancer. Best known for his role on Dawson's Creek, a popular show. He was battling it since 2023, making his diagnosis public back in 2024. So his death obviously bringing attention now to colorectal cancer. Novant Health medical oncologist Dr. Madan Arial joining us now here on Live Impact News. Doctor, thanks for joining us here on such short notice. Appreciate your time.
No problem. Thanks for the opportunity.
Yeah, we want to talk about this because what we're seeing an alarming rise now in cases among younger men with colorectal cancer. Can you explain what's happening?
That's true. So we're noticing alarmingly increased rate of colorectal cancer. There's approximately 2 to 3% rise in the last 15 to 20 years or so, and we're seeing these colorectal cancers as young as in the 20s. Like I have patients who are in their 20s and 30s. They are getting colorectal cancers, which we hadn't seen before, and this is quite alarming.
Wow. Why is this happening to men in their 20s?
Yeah, I don't know if we know everything, but there are a few things that are certainly worth exploring. But a few things like processed food. So basically, you can put this into two buckets. Something that you basically in your genetics that you can't probably change, because some of these colorectal cancers are genetics and they are inherited, like familial colorectal cancer syndromes, and the others are probably something that's modifiable in our environment, in our lifestyle, and in our diet, and these things. Certainly things like processed meat, certainly refined food, excess of sugars, alcohol, and sedentary lifestyle habits. All those are probably contributing to this. There are so many confounders. I don't think we'll be able to separate which one is which, but these are the things that have been studied so far, and probably what are contributing to increasing rise in colorectal cancer in a younger population.
And James Van Der Beek, he said he was diagnosed with stage 3. What does stage 3 mean?
Yeah, so stage 3 colon cancer colorectal cancer is when you have a colon cancer that has gone to the lymph node. It's not a stage 4 where it has gone out of the lymph node and has gone to different places like lung and liver. Many of the colorectal cancers at stage 3 are still curable, but unfortunately his case was not that one, but that's when it has gone to the lymph node. In that scenario, we usually do a surgery, and in order to decrease the chance of recurrence or chance of coming back, we give a chemotherapy after the surgery.
Okay. What are the warning signs and symptoms then that people should watch out for?
Yeah, absolutely. So, things that should not be absolutely ignored include when you notice blood in the stool. That's a very important sign and symptom that maybe it's related to hemorrhoid, but there might be other things going on at the same time, like rectal cancer or colon cancer. So that should never be ignored. Other things like abdominal pain, discomfort, or change in bowel habits. Like one time you get diarrhea, one time you get constipation. This has been going on for the last few weeks. That's probably means that maybe there's something going on in the colon or rectum that might be causing these symptoms. Besides that, some people at times can be just diagnosed with anemia because they have been losing some blood in their stool that you can't basically notice, but it's probably coming from somewhere from the gastrointestinal tract, and that might be from colon cancer. And then when that happens, we start noticing that maybe there's something else going on, and we should look deeper into seeing whether there's a colon cancer or not in this population.
So screening guidelines have now been lowered from 50 to 45, colonoscopies
Correct.
starting at 45. And who should consider getting it even earlier?
Yeah, so definitely. So if there's a family history, definitely should get earlier. 10 years earlier than 45, or whenever your first degree relatives was diagnosed with colon cancer 10 years earlier than that. That's one. The other is, if you have other risk factors, like for example, inflammatory bowel disease, like ulcerative colitis, or Crohn's disease, those population are at higher risk of getting a colon cancer, and obviously other familial colorectal cancer syndromes like familial adenomatosis polyposis. What we're trying to do here is trying to detect those colon polyps earlier, so that when you detect those colon polyps earlier, you can basically take it out so that they don't turn into these colon cancers later that would be bothersome and then maybe hard to tackle at that point.
And what lifestyle changes then can people make right now to reduce the risk?
Absolutely. So, eating right, eating habit is very important. Limiting alcohol is important, and physical activity, absolutely. And besides that, once you have done all those things, getting into the screening on time is very, very important, so that we can detect this earlier and then get rid of it when we find one. So.
Any final message for our viewers that we should share about colorectal cancer, Doctor?
Absolutely. So, final thoughts. Colorectal cancer is when detected early, is a curable disease. Screening is very important. That's how we can detect it early. And there has been a lot of push in doing this in all the communities, and that's what we should focus on. And eating healthy, and then doing right thing, and physical activity will get you there.
All right. Novant Health medical oncologist Dr. Madan Aryal, appreciate the conversation and information, and we potentially save some lives out there trying to get those screenings done early, if not at least on time. Thank you.
Thank you. Thank you very much.